I'd like to welcome everyone. My name is Kelly Fuller. I'm the Vice President of Workforce and Workplace Innovation here at the Columbus Chamber of Commerce. And we want to thank you all for being here today and joining our launch of a Better Us webinar series. This series is highlighting holistic health and wellness and is the first of our monthly informational sessions promoting holistic health and wellness in the workplace. We all know that wellness is not a perk, it's a business imperative. With rising healthcare costs and increasing demands on employees' time and energy, supporting the whole person wellness is essential for a sustainable, productive workplace. In fact, national data tells us that 40% of employers now offer some type of wellness resources, and those that do have often better outcomes when it comes to retention, lower absenteeism, and overall improved morale. The Columbus Chamber is helping employers across our region build healthier cultures, reduce long-term costs, and support their teams in meaningful ways. So today, we're happy to kick off the beginning of our webinar series, A Better Us. And I'm happy to introduce our friends from Central Ohio Area Agency on Aging as we discuss holistic support for older workers and caregivers. Before I introduce Melissa and Alan, I just want to let everyone know we're going to be together for approximately an hour. We're going to go through the presentation, but along the way, please feel free to add questions or comments in the chat. We'll be keeping an eye on that. And on the back end of the conversation, we'll open it up for those questions, answers, and comments. So now it's my great pleasure to introduce Melissa and Alan. Melissa?
Good morning, everyone. Kelly, thank you for that. Thank you for, excuse me, inviting us here. We're really excited to be a part of this. We're passionate about the work that we do. Oops, sorry. Technicalities, right?
Oh.
We're passionate about older adults and people with disabilities. I've been with COAAA for over 10 years now, done a lot of different things. I started my career at Nationwide Children's Hospital before it was Nationwide Children's, have worked for the Ohio Department of Medicaid, worked with the entire age span. And now, we really focus in my division on health-related social needs and meeting those gaps in care. So at COAAA, we are one of 12 area agencies in Ohio. We are an 8-county region, so we cover Franklin County, the 6 contiguous counties, and Fayette County. So we're kind of unique as an area agency on aging because we get to serve the urban population, the suburban, and the rural population. And so we're a case management agency first and foremost. We case manage, over 12,000 individuals aging and disabled. So we do serve, under the age of 60, but predominantly it's over the age of 60. We case manage, about, 12,000 to 13,000 every day. And then we provide services to about 25,000 individuals in this 8-county region every day. And so we do a lot of different things. We have passport waivers. We have a Franklin County senior options waiver for case management. We do dual eligible, so people who are Medicare and Medicaid. And then in my division, we really work with private insurance, so a lot of health plans, Medicare Advantage, commercial insurance. So really, it's the full spectrum. So when I'm talking about COAAA, I often say we're the one-stop shop. So if you don't know who to call, if it's anything aging and disability related, caregiver support, give us a call and we'll either take care of it or we'll figure out how to take care of it. And then I want to pass it over to the clinical manager in our division, Alan Roberts.
Good morning. Thank you everyone for showing up, and thank you to the Columbus Chamber for hosting us. Alan Roberts, as they mentioned, I'm a licensed social worker. I've been with the COAAA for about 1.5 years now, clinical manager in our division, and my role primarily is to oversee the programs within our division and manage our team. And so it's been a pleasure working here, and I'm glad we have this opportunity. So I will go ahead and jump right into our presentation, and like Kelly said, at the end, we'll take questions. So, yeah. So really, we want to jump and talk about how we can provide support for older adults in this multi-role society. And so for the first time in U.S. history, adults age 65 and older are projected to outnumber children under the age of 18 by the year 2034. And then every day, 10,000 people in the US turn 65. So baby boomers will be 65 this year. That makes a dramatic shift in the way our population has been aging. And so it's not just about age. What this really is about a generation that's balancing both work and caregiving roles in ways that we haven't seen before. And so today we're going to explore ways that employers, support organizations, and communities can better support these employers and caregivers. And because they are vital members of our society, and in this workforce, we have to make sure that we're taking care of the people that are taking care of our agencies. Let's look at some data. So 30% of the population is 55 or older. Older adults are staying in the workforce longer, and 1 in 5 caregivers is over 65, and 60% of grandparents over 50 provide childcare for their families. So this tells us that older adults are engaged in both family roles and economic roles. Older adults are the driving force in our economy right now. And so with them staying in the workforce longer, they are needing different types of supports. And they're having to balance employment or being a caregiver, and it can be really exhausting. It could increase mental health concerns. They could make people more isolated, more depressed. It could affect both their physical and mental health. And so people are they could miss doctor's appointments and different things like that because they're working. And so these statistics are striking. And what we want to do is make sure that we are providing people supports that are sustainable so that they can sustain these roles, both economic roles and their community roles. So it's having a huge impact on the way employees perform. So employees miss 6.6 more days a year on average because they're providing care. And so this can increase issues at work. It could increase problems at work, and that's bad for employers, right? As people who employ other people, we want to make sure that our employees are that they're maintaining their health, that they're happy, and that their work-life balance is good. And if they don't have the supports they need, it's going to affect that in a negative way. And so it increases absenteeism. It causes people to retire earlier than they want to or than they need to, which again, we know what it costs to onboard and hire a new employee. And if people are retiring earlier, there's a lot more money that businesses are spending trying to recruit and retain different talent. And it's reducing the workforce participation. And that overall, we talk about employment numbers and things like that. Our unemployment could be rising, and this is a factor. So what can we do? What can employers do? There are lots of different things that as a society that we can do to help balance this. One thing is flexible scheduling and remote options. So in our division, we just hired a new employee. She's a caregiver for her father and her mother. And one thing that stood out to her is that we have flexible scheduling, so she can help her parents get to the appointments they need to and get the care they need while still maintaining a full-time job. And it doesn't include extra stress on her end because she has the ability to do her job and still make sure that her caregiving responsibilities are up to par. EAP programs, employee assistance programs, are very vital. Lots of times, and people who are caregivers don't even realize the emotional toll caregiving takes on them, or they feel guilty because of that emotional toll. And so having an employee assistance program could help them. It really benefits them, and it benefits the overall agency as well. On-site or subsidized backup care. And so that means, some employers, if they have things in place so that their employees can leave if they have to and come back to work later, or have a backup care network within that agency, that may be helpful. Wellness incentives that are tailored to 55 plus, as well as policies that reflect this. If they have caregiver leave policies that are in addition to typical FMLA or typical leave options, that help as well. So having caregiver leave policies, if you after this, if you guys want resources about different caregiver leave policies, I know the AARP has really good resources. You can reach out to us. We can send you those things as well to kind of look into that if your agency doesn't already have it. Another thing that can be done is raising public awareness. This issue is invisible in a lot of spaces. I know until I came into this role and started working with this population, it was something that was invisible to me. And in parts of my life, I've been a caregiver as well. And so having having conversations like this, which is why I really appreciate that the chamber has given us this opportunity, because we have um, different areas where people don't talk about it. And we work with a lot of grandparents that are in that sandwich generation. They're taking care of their parents and they're also taking care of their grandchildren or great grandchildren. There's a lot of kinship care out there right now. And so these dual roles are going unrecognized. And so we need to make sure that policymakers and employers alike are paying attention to this and they're raising awareness. So things like social media campaigns, partnering with local media stations, even as small as leveraging those conversations at work. If you have an internal intranet, doing an article about caregiving or caregiving resources that's out there, bringing in a speaker from a local AAA or another support agency to talk about this, and educating your staff about it. Some caregivers aren't even aware about the resources that are available to them. And so one thing at our agency that we have for caregivers, it's a platform, it's a free digital platform called Tralta. It's very beneficial. And when we go out and we speak to people, they don't even know that it exists. All right, and so I'm gonna pause right here. That's where I am, and I'm gonna hand it over to Melissa to talk about the caregiving profile.
Thanks, Alan. And so this study is from UC Davis in California. And when, again, we see this every day, we're living this every day in the work that we do. I'm also living this, every day in my personal life. But it is amazing to me each time I see these statistics. And like I said, I've been here at COAAA for over 10 years. These numbers keep growing. It keeps getting higher and higher. And there's a lot of different reasons. I mean, technology, we're living longer, we're healthier. But with that comes, these other issues. My mom is 77. She has an upholstery business that she started with my dad. He passed away 7.5 years ago, unexpectedly. And my mom keeps running this business. And for a lot of different reasons, but it's partly out of necessity. Her mother lived until she was 94. So my mom's hopefully going to have a long, healthy life. My grandmother lived independently. My mom was running this business and caring for my grandmother. My grandmother passed away 3 years after my dad. And so my mom was a widower. She was grieving. She was running her business, and she was the caregiver for her mother, who was in her 90s, who wanted to live independently at home. So that was wonderful that she could do that, but it put a lot of pressure on my mom. She was the only child that lived here in Ohio. We helped out as much as we could, but again, we're all busy and doing the best that we can. So when you look at this, 90% of people who are caregivers are providing a really high level of care. And I can speak to that, the complexity and the expectations. So again, 7 years ago, my father-in-law, who was 85, very, very healthy, mowed 2 acres of lawn, every week. He had a valve replacement, cardiac valve replacement years ago, and he had a dental procedure and he got an infection in the valve replacement. And so he needed to come home. He either needed to go to a skilled nursing facility, which he did not want to do, or he came home with a PICC line, a central line, and IV antibiotics twice a day. And so that's what he wanted to do, and that's what we made happen. But again, I'm a nurse. That was comfortable to me. That's where I felt like a nurse again because I hadn't been at the bedside for a long time. But it was a lot of responsibility because I could not do it all and work full time, and so my family members, my sister-in-law, my husband, everyone had to be trained on how to do that. This is skilled nursing care that we're expecting people to do at home. So it's a very high level of care, oftentimes that we're asking. A lot of it's personal care. We're transferring people out of the bed. We're helping them bathe, setting up their medication. Making all their doctor's appointments. And so for the work, people who are in the workforce, that's a lot. And if you look at these statistics, most caregivers are providing 40 hours or more of care to their loved one. And many of them, are working. And so we really need to think about that. 73% of caregivers are providing this much care. And so, of course, when you're trying to juggle everything, something goes by the wayside. So caregivers, have worsening health outcomes. They're not able to take care of themselves because they're busy taking care of everyone else. Oh, sorry, Alan. Um, and so another thing I wanted to point out, and I think it's really important, especially as employers, that we're thinking about finding that non-white caregivers are engaged in higher intensity tasks and they have fewer resources. And, there could be a lot of speculation on, what exactly is causing this. But I think a lot of it in the work that we do, that we've been doing, really focused on for about 5 years here, I think it's related to the social drivers of health. People have a lot going on in their lives and they don't have the time, they don't have the knowledge base, and they can't search out these resources. They're just getting through the day. So they can't spend a lot of time figuring out, what is a resource out there like True Alta. And so, like Alan said, True Alta is an online platform for caregivers. It was developed maybe 6 or 7 years ago by a company in Canada, and it was started with dementia patients, people with Alzheimer's, and how to support those caregivers. And it's really, really challenging. So this online platform, like Alan said, is free of charge. You can go onto our coAAA.org, go to the True Alta link, and actually I'll put it in there at the end of this. And it's just you click on a little icon and you can get signed up for free. And what we know about caregivers is they don't have a lot of time and they don't take care of themselves. So they focus on self-care, meditation. Teepa Snow is a world-renowned specialist on dementia and Alzheimer's. She does a lot of talks and information, infographics on True Alta, but it also provides an opportunity for caregivers to find the information when it's convenient for them. It may be 2 o'clock in the morning, it may be, 10 o'clock at night. It's also, they've been really cognizant, and it was why we chose this platform, because they give you information that you can print out. They give you information in video format. They give you information in audio format, so as you're doing the dishes and you have your AirPod in, you can be listening, to something. And it also gives you that basic health information. So there's information on diabetes, whether it's me as the caregiver, I have diabetes, and it's not managed because I'm managing everything else, or information on heart disease, about the person that I'm caring for. They also have videos, and we have it customized to COAAA to add some additional information, but information on support groups. So we here at COAAA have a caregiver support group every Monday, and that's virtual. We used to have them in person. Virtual works better. A lot of things came out of COVID. Some of them were good. And, technology and using these virtual platforms has really been helpful. But Trualta also has support groups. It has a respite platform, so they know that certain music really helps people, who have dementia. And so you can put that music on, and then the caregiver may be able to get, 30 minutes to go shower and take care of themselves. And so that's one of the resources that we have. Alan, now next slide. So the cost of caregiving, um, it's huge. It's costing employers, productivity. It's costing the caregivers their own health. So when I'm busy trying to balance all of this, balance, not missing work, balance getting my loved one to the doctor, taking care of them, I am neglecting my own health. And so that increases ER and hospitalizations because I'm a caregiver, I'm trying to work. I can't make a PCP appointment and go to my primary care, because, I'm feeling lightheaded or I'm having a headache, and maybe have symptoms of, high blood pressure. And so what happens is it becomes urgent and emergent. So I'm just like I said with Trualta, you're getting, the knowledge when you can at 2 in the morning. You're also getting your health care, at when you can at midnight or 2 in the morning. So that raises costs for all of us. When we're using the ER and it's an avoidable admission, that's a huge, huge cost to health plans, to employers. So really, the employers focusing on keeping it as flexible as possible. And it would cost you a lot less money, to be a little flexible and let them start their day, an hour or two later, than paying, the insurance premiums. And if you're self-insured, paying for that ER visit because they really didn't have any other time to get their care. And so, we do this a lot. We have a care transitions program in our division, and we know that avoiding the avoidable readmission is huge. And we really need to focus on that. And it's a win-win for everyone, in our society. And so the stress, again, stress causes health issues. You have high stress, you have higher risk of high blood glucose, so diabetes, hypertension, heart disease. So anything that employers can do to try to alleviate some of that stress. One thing that we're proud of here, we have a workplace wellness um, complete section. And we have a calendar and we have events going on every month, usually at least once a week. And it's focused on, really understanding that we can't care for the people that we serve. We can't care for our families. We can't care for the loved ones that we're caregiving for if we're not caring for ourselves. And so we also have a meditation room, a quiet room that we just remodeled, and people can sign it out just like another conference room in our building and really go and spend 15 or 20 minutes reflecting, meditating, some mindfulness, praying, whatever you need to do to recharge your battery. Because again, we have 400 staff members, over 400 here at our agency. 270 of them are nurses or social workers. And we're out there every day in people's homes, and trying to help them when, they're really, really stressed, they're really sick, they're really needing a lot. So we have to take care of ourselves or we can't take care of the people that we serve. And so, when caregivers, are exhausted, they are stressed out, they're getting burnout, their health is declining. They have to have an early exit from the workforce. And this can be really talented, skilled people that you need, that you want to keep, but they just cannot keep doing that. And then that causes a lot, um, you know, it puts a lot of pressure on them. And, it's causing them to be more isolated, more lonely. It's causing financial stress, but they have to make that really tough choice because they need to take care of their loved one. And so employers, things that we can do, it's always, again, about, um, encouraging people to think about themselves and reminding them, that they have to do this self-care. So there's a lot of different things. I mean, one of our wellness activities is nutrition. So we have someone coming in and they're showing us how to do a very quick, under 30 minutes, healthy meal, that we can prepare when we get home. So there's a lot of different things that you can do. But really being mindful, and taking the time and investing on the front end, so it'll save us all, time and energy and money on the back end. Next slide, Alan. So partnerships for impact. For us as a community to be as effective as possible and to do the most that we can, we have to collaborate. And, just knowing your resources. I'm going to put the area agencies on aging at the top all the time because, we are the social care clinicians that really are boots on the ground. We know funding opportunities, that are in our region, that are local. We have experts, who are seeing people in their home. And really, you don't fully understand the challenges that someone may face unless you see them and meet them where they are. So we're seeing people where they live, where they work, where they pray, and seeing the challenges, that they have. Um, Government agencies, so ACL, the Administration for Community Living, is a federal agency, but they have tons of information and resources that you can get online. Offices on aging, so we have a state office on aging, the Ohio Department of Aging, and then we have county offices on aging. And Franklin County Office on Aging, they have a lot of different programs. They have actually a caregiver support program, a kinship care program, and so there's, again, you just have to seek out. And what I would recommend to employers is, have some of this information, have the COAAA brochure, put it in your break room, flyers on our support groups. We have a very robust education department here at our agency, and we have different topics, put some of those flyers out. Our education programs are free of charge. We made that decision a couple of years ago to waive the fees. And so it's good for employers, it's good for your staff, and family members, to come out, whether you need it for yourself personally or you want to just educate yourself so you can support your team. Healthcare systems. Like I said, we have in my division a lot of private contracts with health plans, and that's imperative. They understand that we have to do this preventative maintenance. We have to address these health related social needs for us all for it to be sustainable, to not put stress on, the healthcare systems, and, government resources. And then your nonprofits, United We Care, Caregiver Action Network, and then obviously having us here today and just partnering and giving us this opportunity to let you know what we have available, but then also, for us to know, the resources that we have through the chamber. And then I just want to give a few stats on COAAA. So again, we're an 8-county region, one of 12 in Ohio. We have last year we had 632 caregivers enrolled in our weekly support groups. We have a caregiver toolbox, and again, this is on our website. We had over 1,000 participants who participated in that training on the caregiver toolbox. We had over 2,800 calls to our caregiver support specialists last year. Caregivers just desperate for information, needing support. Our online platform, caregiver platform, TrueAlta, saw a 57% increase in enrollment last year. So there's a need, there's a huge need. We did over 5,700 screenings for long-term services and supports. So those are people making a referral, whether it was a hospital system, whether it was an employer, trying to help out one of their staff members, or a family, just desperate to keep their loved one home for as long as they could, but not knowing how to navigate that. So we do long-term care consultations. Those are free of charge. We can do that over the phone, or we can go out and sit with, someone in their home, and talk about what are your options. Would you qualify for Medicaid? Is that something you would want to sign up for? We have a Medicare specialist who gives presentations and provides education all through the year, just to let people know what are your options? What is Medicare Advantage? Do I want this plan? Should I look at that plan? Should I look at a dual eligible plan? And so we did, out of those calls and the information that we did almost 47,000 home visits last year. And so we're doing probably roughly about 150 home visits every day, in our 8 county region. In my division, we did 950 social drivers of health assessments. So 3 years ago, we started this SDOH accelerator program. We developed an SDOH screening tool and had that copyrighted. It's gone through IRB, so it's an evidence-based tool. And it really looks at the needs in our region. We kind of tailored the tool, to what we were seeing in real time, what people were needing. And you don't know what you don't know. So we're asking questions that people didn't even know, that maybe they needed support in this area. And then we have an RN intervention, and we did over 400 RN care transitions visits. So really, seeing people when they get out of the hospital, making sure that they understand their discharge instructions, or that they even have their discharge instructions, because we find out a lot of times those get misplaced. We go do a complete medication reconciliation, because it's complicated. I mean, I remember when my father-in-law came home and they give you a box full of things and a paper. And, what you heard in the hospital, when you get home, it's very difficult to translate it and how we're going to modify it to make this work at home. And then we have a housing assistance program. And so 239 people were able to stay in their home, which again is huge and imperative, through rental or utility assistance through our agency. Okay, next slide. And so pilot opportunities. Again, we do a lot here at COAAA. And so pilot opportunities that we have, again, healthcare systems are piloting with us. We're helping them, meet the needs of the people that they are serving, and also, helping us meet the needs of the community. And so again, I spoke about our SDOH accelerator program. We currently are piloting an RN health intervention for Medicare and Medicaid members. And it's really focused on hypertension, high blood pressure, and diabetes. And again, those two conditions are exacerbated by stress. And so we're seeing a lot of caregivers who are really neglecting their own care. And so we're going out, we're doing A1Cs in the home, so checking their blood sugar in the home. We're doing hypertension, high blood pressure education. We're providing them, with blood pressure cuffs and actually teaching them how to do it, how to take their own blood pressure. We provide them with logs so that they can take this information, that they're gathering at home, and they're relaying that to their healthcare provider so they can really get a good, clear picture of what's going on and what may need to be adjusted in their treatment plan. We have a pilot program with social workers and community health workers that we're working on. with the faith-based community, to really, again, meet people where they are. We just did an event with Columbus Humane, so the Humane Society, where we had our social workers there doing these social drivers of health assessments. And we had our nurses there for anyone, who had diabetes or hypertension, high blood pressure, or suspected that they had. And so we were, doing a health screening there. A lot of people really love their fur babies and they're taking them to the doctor when they're not taking their selves to the doctor. And so it was an opportunity to, take care of the person and the pet at the same time. So we're really thinking outside the box, trying all of these pilots. We have a comprehensive caregiver support program that really provides holistic care to the individual. And this is something that we would love to pilot with an employer, to be able to, teach them about Trulta, get them signed on, get them into support groups. But then also think about having this RN who can answer questions, whether it's questions about my own health as a caregiver or questions that I have about my mom, that I'm caring for. Um, and then, again, Alan and I were talking just recently, about businesses being able to collaborate and join their, forces and their funding and, be able to sponsor a community health worker, possibly at our agency, who would be someone who could, again, meet people where they are if we need to go out and do a home visit and really assess, where the needs are and what are the resources. Because again, community health workers and our social workers and our social care clinician team, we know this region and this area and the funding or the resources that we have available. And I think that's it for me, Alan.
Yes, so I'll jump back in really quickly and then we'll take time for questions. So a call to action. So what can we do? Employers need to look at their policies, audit your policies and make sure that these policies reflect flexibility and they're able to give caregivers the opportunity. Listen to your employees, survey them, ask them what they need. And that's a bit part of what we do here at our agency is we ask our teams, what do you need? And we're able to adjust based on that. So for community-based organizations, expand targeted resources for working caregivers. That's something that we can do, that we can pilot with employers to make sure that we are providing a service for them. Communities need to normalize multi-generational care roles. This is something that we've never experienced before, but it's here. And advocate for state and local policies that provide direct relief to family caregivers, like stipends, tax credits. Those things also help lessen the burden. So final thought, I'll leave you with this quote. We cannot talk about the future of work without talking about the future of care. These issues are intertwined, and we need to address them together so we can create a healthier, more productive society. Thank you.
Thank you, Alan and Melissa, for a very comprehensive and informative conversation. We do have a couple of comments and questions. And I think maybe in this call to action piece, Alan, I think you maybe started to answer a question from Robin about, is there any talk of employers being actually mandated to offer alternate hours or flex time so that folks can't, that they don't have to miss work and the needed income. Robin also mentions FMLA is nice, but it does not pay the rent and also doesn't always apply to businesses of a certain size. So are you hearing anything or any thoughts around beyond the auditing policies and some of the other calls to action you have here, anything around what other employers have done and maybe some best practices in that space?
So I haven't heard of anything in that space about mandating employers to do those things. And so I know that here we have a couple of different things, like we have paid family leave. I know through the city of Columbus, paid family leave is something that we have for caregivers, where it is a paid leave and it coincides with FMLA. So the position is protected as well. So I know, and like she said, smaller agencies aren't able to do that, but if you can offer some sort of leave or benefit like that to give people the opportunity to take that time off, or a lot in our division, sometimes we cross-train everyone. So we make sure, so we have someone that is on maternity leave right now. When she comes back, she's not going to have a huge workload to catch up on because we have someone covering those. So even like float positions and different things of that nature to help, again, lessen that workload. So when people do take time off, they don't have to come back and work double duty to get caught up. Melissa, did you have anything to add?
No, I mean, it is, something that we're always advocating for. But again, we have to pay the bills, we have to keep the lights on. And so, it's that balancing act, even for our agency, our division that we have, with someone on maternity leave, our division is small, so we have cross-trained everyone. It's been a necessity, for 8 years now that we've been, doing these private contracts. And so I just think, again, the more care that you can provide while they're at work, um, will keep them from missing work, because we need these great staff members working. Paid family leave is wonderful and it's a great benefit that we have, but it does put you in a tough position, at trying to manage the contracts or manage the care that we're trying to give to the community. So I think being as efficient and effective as possible, cutting out unnecessary things, and then having a plan to cover, when people need to be off. But yeah, it's something we're always trying to advocate for, to understand. But I think again, putting resources in things like TrueAlta, like caregiver platforms and support groups is imperative.
Melissa, do you or Alan have like a direct link to TrueAlta that you could pop into the chat?
Yes, I'll put that in there.
Thank you. That would be fantastic. I just have a couple of questions myself, being the workforce geek that I am. But when we talk about the large number of people in the workforce that are older workers, and even though that represents a very large number, you also mentioned or referenced on a couple of slides, there's a loneliness factor as well in being an older worker, especially an older worker who is a caregiver on top. So maybe isn't able to participate in some of the things that others that don't have that added layer of responsibility. What are some things that employers could do to recognize that there might be an issue of loneliness? And are there things that employers could do to address that, to support that, so that people feel taken care of in that way as well?
Yeah, so I'm always a huge proponent of counseling and behavioral health. So that's one thing that I will say, having, in addition to EAP services, having a stipend or an incentive that helps pay for those things, or being able to give employees flexibility to take an hour on lunch to have a virtual visit with a counselor. Um, if you're able to do that. Another thing is employee resource groups. They're huge. And so maybe having a caregiver specific resource group or a workplace wellness activity that gives people the opportunity to connect. Because when we have those group things, we know natural connections occur. So there may be two caregivers, like our agency, we have over 400 employees. There's people we don't even know. But if we have that and they're interested and they show up at that group, they may connect with each other and become a resource for each other down the road. And so things like that are things that can help employers um, provide those kind of services to employees, especially from that when they feel isolated. Because again, it's really hard when you feel like you're on an island all by yourself.
Sure, absolutely, absolutely. Um, a couple of lots of takeaways today, but just a few things that really stood out to me. Very eye-opening. The fact that 73% of caregivers are spending 40 hours a week in that role as caregiver, and they're probably working a full-time job too. So when we are thinking about our employees and our teams as businesses, keeping that in mind is huge. And like, where do we get started? Michelle, our friend, is from Expert Office, has just posed the question, as a business owner herself and a caregiver, she's trying to figure out where to start. What would be, you guys have given a lot of really great information. What would be maybe step one for someone like Michelle, who's a business owner herself and a caregiver? where do I go now?
Well, you know, I think what I would do, I would sign up for Trualta. You know, it's easy, it's free, it's on demand. You can get, yay, Michelle, I just saw your note. So Michelle just signed up. There are so many resources there. And again, there's the support groups. So it can address some of your social isolation and you know, understand that you're not on this island alone. There's others, you know, that are right there with you. But again, it gives you tools to make you more efficient and effective. You know, so there's a lot of information, a lot of education, so that you can provide the care quicker, or you can get a little bit of respite, you know, by using, you know, the respite opportunities on Trualta. So if I were someone who was employed as a caregiver and needing support, that's where I would go. The other thing that I would suggest is, you know, if you think that you need some help at home, some home and community-based services, I would reach out to the Area Agency on Aging and just have a long-term consult, you know, and just see, you know, you don't know what you don't know. And so we could, you know, recommend some things that maybe could be very simple and, um, you know, something that doesn't cost a lot of money, but you hadn't thought about that. You didn't even know that that would be a resource. So it doesn't mean that you have to be eligible for Medicaid to get our services. You know, again, Franklin County um, Office on Aging has the senior options levy, and our agency provides the in-home case management for that. And so it's on a sliding scale. So maybe having an emergency response button for your loved one would really take a lot of pressure off of you. The other thing that I can share personally for my grandma, we put cameras in the home, you know, so that we could, because my grandma would, God love her, she again lived independently until she was 94. But when she would hang up the phone, she never got used to those cordless phones. And sometimes she didn't hang it up. And so we would be calling and calling and calling. And then my mom could easily look at the camera and say, oh, she forgot to hang up the phone. So we could even talk to her and say, Grandma, you forgot to hang up the phone. I've been trying to call you. You know, so there are things that you can do to improve your quality of life as a caregiver, but also improve the quality of life of who you're caring for.
I
Thank
wanted to
you,
go back to
Elizabeth.
the first question, and yeah, give a couple other things that we could employers could potentially often. And so one thing is like help subsidize in-home care. So if you can't offer a lot of time off and people don't, their traditional backup plans for in-home care falls through, maybe there's something that your team can do to subsidize it. Offering floating holidays or a couple extra personal business days so they can take off that guilt-free time, even though you may not be eligible for FMLA or you can't offer paid family leave. Those small incentives will also go a long way. And so I just want to add that in, a couple of notes that I had. I didn't want to leave that unaddressed.
No, that's really important. This has been a great conversation, whether you are yourself an older worker, older business owner, or in a caregiver situation, or whatever, wherever you sit. This is super helpful and amazing resources that are available right here to us in this region through COAAA, our friends at Central Ohio Area Agency on Aging. Alan and Melissa have their contact information there as well. And another thing I'd like to say is, as employers, I love the fact that you have these weekly free sessions, that can be helpful for an individual or a business owner, or just to be able to share that with your team as another resource, especially for our small business owners who may not have all of that, available to them. And also the different, I think, again, with Trualta is a huge game changer, I believe, for a lot of people just to know about that. Um, but we have certainly appreciated your time here today and all of you that joined us on this call. Just a reminder that we will be doing this is a monthly series, A Better Us, helping all of us in the community, businesses and others understand that, like, all the great resources that are out there. In August, we'll be inviting our friends from Jewish Family Services to talk about how can business owners and employers help our refugee and immigrant employees, our associates, navigate health and wellness and some of the complexities of just being in a new country. So again, we thank you so much from all of us at the Columbus Chamber of Commerce. Everyone stay safe, be well, and we'll talk to you all soon.
Thank you.
Thank you.